guys, and welcome back to our first aid video number 3. Hopefully you found the first two entertaining and helpful. So today we are going on with our third section, which is finding out what is wrong with a person and how to do a primary and a secondary survey.
Hi guys, subscribe to my channel now so that you do not forget. Hit that bell icon and get notified of my further uploads. Lastly, feel free to comment. Show me some love by giving me a thumbs up at the end of the video.
So, without any further ado, let's get going. The first thing that you want to do is when you approach a person is see if the scene is safe. Do a quick scene size up and make sure that it is safe for you and safe for the person that you're going to help. Also, try and find out what happened. What does the scene look like? Is it an accident scene, or maybe the guy collapsed while mowing the lawn? How many people are involved? If there is more than one person that has been injured or need to help, go to the motionless, quiet one first. If there is no immediate threat to life, do a quick history and do a quick primary survey. That means check out the person and make sure that he's fine. Do an examination, head to toe.
Excuse me, sir. You been drinking?
Had a couple of drinks, that's all.
Ah, well, you don't mind taking a wee sobriety test. Right then, would you sleep with my colleague here? Aye? Cuff him.
The initial check will determine whether a person needs life-saving care immediately or as soon as possible, or whether you can take your time and get the history and do an examination of the person. So what do you need to check on your initial checks? First of all, you need to check responsiveness. Is the person awake? Then you need to check the airway. Is it open or blocked? Is the person breathing? And then, is there any obvious or severe bleeding? It will just take a few seconds to determine your survey and to determine what's wrong with the person. So how do you determine responsiveness? Go to the person, shake his shoulders, tap him on the shoulders, scream loudly at him. If you know the person's name, call him by name and see if he responds to any of that. If the person does not respond to voice, you can tap him on the shoulder. Determine whether the person's airway is open. Does it sound like he's breathing normally? Is there any shortness of breath or any wheezing sound coming out, or anything that sounds like his airway might be obstructed? You can open up his airway by using the head tilt chin lift maneuver. If you do not suspect that the patient has had any neck injury, if you do suspect a neck injury, then it's better to use the jaw thrust maneuver. But for today's purpose, I will only show you the head tilt chin lift maneuver.
Another common way to open an unresponsive casualty's airway is to use the head tilt chin lift. Remember, If you suspect the casualty has a neck or spine injury, use the gentler jaw thrust maneuver we demonstrated earlier. But in other cases, the head tilt chin lift will help keep the airway open and assist the casualty in breathing more easily. First, kneel beside the casualty at their shoulder level. Place one of your hands on the casualty's forehead and apply firm backward pressure with your palm to tilt the casualty's head back. Place the fingertips of your other hand under the tip of the bony part of the lower jaw, under the chin, and bring the casualty's chin forward. Do not use your thumb to lift the lower jaw, and be careful not to press into the soft tissue under the chin with your fingers. This could close the casualty's airway. Lift their chin forward until the upper and lower teeth are almost brought together, but be careful not to close the mouth. If needed, use your thumb to gently pull down the lower lip to keep the casualty's mouth open. Check the casualty's airway. If you see any solid objects in the casualty's mouth, whether it's food, loose teeth, debris, any foreign material, use your fingers to carefully remove the material as safely and quickly as possible. Otherwise, it could block their airway. If you notice blood, mucus, vomit, or any other more liquid substance in the casualty's mouth, place them in the recovery position and allow the substance to drain out of their mouth.
To determine if a person is breathing, just look at his chest. Make sure that it rises and falls. Or, if you get close enough, you should be able to hear and feel whether a person is breathing or not. And then checking for obvious signs of bleeding, well, that says it for itself. Just look over the body quickly and see if anything is wet, if you can see any blood coming through the clothing, or if there's anything that you can obviously see coming from the body. So checking responsiveness. As we have said before, if a patient is talking, then obviously he is breathing and he does have a pulse and he is awake. In that case, try and ask him his name and what happened. If the person can answer you correctly, then at least you know he is responsive. If the person is motionless, then tap him on the shoulder and ask him, "Hey, are you okay?" If the person does not respond, then get someone to call help immediately. Normally in a situation there's more than one person, so you should be able to have a bystander standing by and quickly tell them to call an ambulance. Now, checking the airway. In an unresponsive person, the airway must be open for him to breathe. Again, if the person can talk to you, then he is awake and he is breathing. If a person cannot talk to you or cough forcefully, then it means that his airway might be obstructed. In that case, you will use the Heimlich maneuver or abdominal thrusts to get the object out. We will talk about that a bit later in the series. If the person is unresponsive and is lying face up, then you will open his airway, the head tilt chin lift maneuver, if you do not suspect that he is having a neck injury. Now let's check breathing. So we've already determined that if the person is awake and is talking to you, then obviously his airway is open and he's breathing. But if it's unresponsive, then you're going to have to determine whether he's breathing or not by looking at the chest rising and falling. If he does breathe and there's any funny breathing sounds like snoring, wheezing, or it looks like he might have difficulty in breathing, then you can suspect some kind of obstruction. If the person is unresponsive and you have opened his airway, you're going to have to determine whether he's breathing or not. You can look for signs of breathing for 5 seconds and no more than 10. If after 10 seconds you still don't see the chest rise and fall, then obviously he's not breathing. If the person is not breathing, then you are going to have to give him rescue breaths. But that will also be discussed in a later time in this series, because this goes hand in hand with CPR, which we will be basically doing last. Since it's a bit of a complicated thing, it's something that you have to practically do and practically see, which we can't do, but we will discuss it, but I'll leave it for last. And you don't have to give rescue breaths if you don't feel comfortable with it. And obviously if you do not have a barrier device or any kind of mask, then you don't have to do it. All you need to do is compressions, which we will talk about later. So let's talk about some of the abnormal breathing sounds that you can hear and what that might mean. First of all, snoring. The airway could be partially blocked by his tongue. A gurgling sound might mean that there is fluids in his airway. If he sounds like a motorbike, like he's crowing, that could be a partial blockage. Wheezing can be a bronchial spasm, or he might be having an allergic reaction, which could be closing his airway. An occasional gasping breath might mean that his heart has stopped and is doing agonal breathing. It's the brainstem telling the body to breathe, even though his heart is not pumping. Checking for severe bleeding. Quickly scan the body from head to toe with your eyes and see if you can see any blood coming out, squirting out, or oozing out of the wounds, if they are. If you do see bleeding or severe bleeding, stop it immediately by using pressure points or bandages. If you don't have a bandage, take a shirt, a scarf, a dress, whatever you can grab to tie around the wound so that you can put pressure on that wound and then keep pressure on that wound until someone arrives. Congratulations, you have done the initial check or the primary survey. After it is done and everything is safe, the guy's breathing and is not bleeding anymore, you can go over to the secondary survey. If a person is awake, it's much easier because you can ask him, where does it hurt? And he can tell you exactly or show you exactly where it hurts. But an unresponsive person, you have to check from head to toe. During this investigation, you will look for signs and symptoms. A sign is the condition of the victim that you can clearly see and feel. A symptom is something that the victim can feel and can describe to you. Check the victim by looking and feeling for dots. Now, DOTS is an acronym for deformities, open wounds, tenderness, and swelling. Since most of your victims will be awake and responsive, you can focus on the immediate area where the person says it's hurting. So you don't have to do a full head to toe. You can go straight to the ankle or the arm and look at it and see, hey, this thing is broken because there's a bump here that does not belong here. Or this leg does not look anatomically correct. With a person that had a big accident, like let's say he fell from a height, and you can suspect multiple injuries, you're going to have to do a head to toe survey. I'm going to show you now a video on how to do a head to toe survey.
You know, one of the first things that needs to be completed during any first aid process is the head to toe survey. Hi, I'm Captain Joe Bruni, and what we're going to discuss is how to complete the head to toe survey during the first aid procedure or process. The head to toe survey would be first maintaining cervical spine control or neck control of the head and evaluating the head first. We would feel along the sides of the head and the back of the head to determine if we have any type of skull depression, bleeding, looking at the ears and the eyes and the mouth and nose to determine if there's been any injury to the head. We would then move down to the neck, feeling the back of the neck for any deformity, moving on to the shoulders, the rib cage, the chest area, feeling down along those areas for any asymmetry or deformities in those areas, sliding a hand under the back of the person or back side of the person, feeling for any fluids or blood loss or any deformities once again. Moving on down to the legs, checking the legs for any deformities, feeling both front and back for any injuries, blood or fluid loss. The same for the arms, checking both front and back, looking for asymmetry or any type of injuries. We would then check for pulses in both wrists to determine if we have pulses there. And then we would move on to the tops of each foot, feeling the pedal pulses on the tops of each foot to see if we have good circulation to all extremities. Conducting the head to toe survey is a good procedure to follow for any first aid situation. I'm Captain Joe Bruni. Stay safe, and we'll see you next time.
The following injuries can be causes of life-threatening injuries: falling from heights, a vehicle collision, injuries resulting in unresponsive, altered mental status, penetration of the head, chest or abdomen. Some don'ts. Do not aggravate the injury more, and do not move a person that you suspect has injured his back or neck. When you do your secondary survey, always remember to look out for medical aid bracelets, either a necklace or a bracelet around the arm. That information is vital because it can tell you what the patient is allergic for, or whether he is an organ donor or not, or whether he needs any special care or special medicine. Once you've done all of that and the person is alive, why do I keep on saying that? Once you do that and the person is awake, you can start to take a sample history. Sample is another acronym. It stands for sign. What's wrong? Allergies? What are you allergic to? What type of medication can't you take? What kind of food are you allergic to? M stands for medication. Are you taking any chronic medication at this moment? Are you taking any medication at this moment? P stands for past medical history. Have you had an accident before? Have you had an operation before? When last did you have an epileptic attack? That kind of history. L stands for last oral intake. When last did you eat? Not what. I don't care if you had pap or flesh. What did you eat? Doesn't matter. When did you eat last? This morning? Last night? Because if you suddenly have to go to theater, they need to know. And E is events leading up to the injury. It was a car accident, the guy skipped the traffic sign or traffic light, and you got T-boned, and that's what happened. Or you were mowing the lawn, you accidentally cut the cable and you got electrocuted, or whatever led up to the incident. And those are the information that you're going to hand over to the paramedic or ambulance person that is coming to assist you. Lastly for today, what do you do until the EMS arrives? Once you've done your secondary and primary survey, all the bleeding has stopped, you've got your sample history and everything, write it all down on a piece of paper. Remember about the law about abandonment, so don't run away from the person, you stay with him until help arrives. Once help arrives, tell them what happened and give them the paper that you've written down with all the history and everything from that person. That will help them a lot. And if anything changes on the condition of the person, remember to note it down. Well, that's it for today. I hope you enjoyed this video. If it was helpful and meaningful, remember to give me a thumbs up. And please subscribe to my channel and hit that bell icon if you want to get notified of any further uploads concerning this series or anything else that I'm doing. Until then, have a blessed day. Cheers.